be born black with these genetic predispositions for disease, you know, and that way of thinking is insidious because we think of it in so many subtle ways. It works its way into our thinking. But I think that, you know, what our approach has been to try to be more creative in finding ways to place these arguments within frameworks and ideological perspectives that people can understand, people who are not necessarily predisposed to supporting the idea that racism is the problem. So, for example, one of the things that we, you know, so this health disparities issue, we generally respond to it from a social justice perspective. We should address those health disparities because they simply are unfair and inconsistent with the values that we should have in this country. But we've probably got everyone under the tent already that we're going to get with the social justice argument. So we got this idea of what if we could actually do an analysis and demonstrate the economic impact of having health disparities, that it is inefficient for the economy to have people sicker than they should be and unable to work and be as productive as they ought to be. And we did this report and calculated that cost at $1.24 trillion over a 4-year period. The report came out in the 2008 and in 2009 in the middle of the discussions around the Affordable Care Act, and was able to be used to help argue for adding provisions into the law that deal with health equity. So there were people who were concerned about military readiness, people who were concerned about drag on the U.S. economy, an unhealthy workforce, not necessarily concerned about social justice, but we were able to reach some of those people because we were able to create different ways of arguing that this is an important thing. So that's been one of the approaches that we try to use to respond to this issue of meritocracy and
Thank you. I'm going to give you one